Okay, shall we start?
Yeah.
Yes, also we're ready.
Okay, just to let everybody know that this webinar is being recorded. You know, with the Poppy Act, we have to tell you, and it's your decision whether you want to stay or not. So good evening, everyone. And once again, it's my privilege to welcome the International Retina PE Office Manager, Gail Sillier, and Karen Denton, Retina SA Head of Advocacy and Education. Tonight, Karen will be talking about the Charles Bonnet Syndrome, that is visual hallucinations in vision loss. Karen has studied all aspects of nursing, has a degree in psychology, and a 30-year career in diabetes education. She's featured internationally and has chaired various diabetes education organizations. And then we'd also like to welcome all of our attendees. Just a few housekeeping rules. If you have any questions, we will take them after the presentation. You can use the Q&A or the chat buttons, or you can put up your hand by using the shortcut Alt+Y. This presentation is CPD accredited, and should you want accreditation, you can direct it to pe.office@retinasa.org.za. And there is, however, a R100 admin fee for your certificate. Should you, could also please participate in our poll at the end of the webinar. And should you have any questions after the website, you can direct them to pe.office@retinasa.org or visit our website at www.retina.org.za, retinasa.org.za. And now, without further ado, Karen, the Zoom is yours.
Thank you. And there we go. So this evening we're talking about Charles Bonnet Syndrome. And this is something that really needs talking about. And I really hope that everybody who is listening today will take this message to somebody else. It really is very important. As you know, I am with Retina South Africa, and we do a host of things for people with visual problems. And this evening, I'm talking together with Claudette. So I'm going to do the beginning, and Claudette will take over. I'm also proud to be a part of the Low Vision Center of Learning. And I do have a disclaimer that this presentation is made possible thanks to an unconditional grant from Bayer, South Africa. So, the elephant in the room. This is a major problem that is stalking the entire planet, and people are simply too afraid to talk about it. And that is why we need to address this and to get this message out there as quickly and efficiently as we can, both to patients and to professionals. A lot of people think when they get the syndrome, is there something wrong with me? They don't know, but they're too afraid to say, because Charles Bonnet Syndrome is under-recognized, underreported, and totally underdiagnosed or misdiagnosed. It's diagnosed very often as all kinds of mental disturbances, including dementia, Alzheimer's, etc., etc. Let's start at the beginning. Who was Charles Bonnet? He was a Genevan. He lived in Geneva, Switzerland. He was a naturalist and philosopher, and he noticed that his visually impaired grandfather saw patterns, figures, birds, buildings, carriages that were not there. But his grandfather was completely mentally healthy, and that is the big point that we have to make today. People with Charles Bonnet Syndrome are completely mentally healthy. And I'm going to stress it again and again and again. They are in good mental health. In fact, Charles Bonnet's grandfather himself was a highly respected magistrate who retired while he was getting these hallucinations. And it's ironic to note that later in life, Charles Bonnet himself suffered from the same type of hallucinations. So I'm going to stress once again, people with Charles Bonnet are completely mentally okay. But we don't know much more about Charles Bonnet syndrome, even 250 years after Charles Bonnet first described it. We don't even know how many people have Charles Bonnet syndrome. How many are there? Epidemiology is very confusing because it is so underreported. We simply don't know. Some reports say that maybe 15% of people with little to moderate vision loss might have it. Maybe 50% of people with moderate to severe vision loss. The mean age is 70 to 85, but you're going to see just now, it affects people at every age, even little kids. Small children also, surprisingly, get Charles Bonnet syndrome. If we look at some of the older research, this is a few years ago, about 3-4 years ago, the Canadian Institute for the Blind looked at 2,500 patients coming to their eye clinic with macular degeneration, diabetic retinopathy, and glaucoma. And they found that nearly 20%, that's 1 in 5 of these people reported hallucinations. But as I said, these people were fine. And half of people with macular degeneration, they found to have hallucinations at some or other time. The Canadian Institute for the Blind went on to say that many doctors believe that this phenomenon is very rare. However, the study showed that it is actually quite prevalent, but people are afraid to tell their family, their friends, their doctors that they are experiencing hallucinations because they are afraid of being misunderstood as having some or other form of mental illness. So, do we know then how many people get Charles Bonnet syndrome? Recent studies are showing us that the numbers are much higher than we first thought. And an ongoing study, this is only from last year, in fact, showed us that children, as I said just now, are also affected. This lack of data is partly because people are too embarrassed to admit that they have these hallucinations. People are afraid that admitting it will make it real for them, and they don't want to admit to anybody else that it is real. We also find that, strange enough, in India, people with Charles Bonnet syndrome think that they are blessed, that this is something very special that is being granted to them by the gods, and they relish it, they really enjoy it, so they don't report it as a problem. The lack of data is also due to rather confusing diagnostic criteria. And now, in the past year, during lockdown and with the pandemic, this has become even more confusing, as we will see in a moment. So in a nutshell then, they used to think that visual hallucinations in psychologically normal people who have lost some vision was what was CBS, or Charles Bonnet syndrome. We now know that there's a little bit more to it than that. A definition from Podol that was used until about a year or two ago said it is the presence of visual hallucinations, like these little figures in the bathroom, with no psychological pathology or issues. And I want to stress that there is no dementia, there's no Alzheimer's, there's no other pathology here. And I will show you just now how to differentiate. People have clear consciousness. They often do have visual impairment, but not always. And we know it is exacerbated by stress. And unfortunately, the more stress we have, for example, in the past year, the greater the risk of getting these hallucinations. And the more hallucinations you get, the more people become stressed. So this vicious cycle feeds itself, and people get more and more stressed, more and more hallucinations, more and more stressed. It just carries on and on and on. Another effect of the COVID epidemic, they had a look at Moorfields Hospital in London, where they found that 50% of respondents that they surveyed in the last year reported that their visual hallucinations increased during the COVID pandemic. And it is probably due to loneliness and isolation. But there are dozens of reports appearing in the media every single day, in the scientific journals, in the medical journals, everywhere like that. And I've just picked up one or two here to show you. Hallucinations have been seen as another troubling symptom of COVID. And this is not necessarily in people with a visual problem. This is everybody. Doctors are saying that hallucinations caused by the virus could last for weeks. They may vary from very subtle to causing the patient a lot of trauma, and they feel quite uncomfortable because, unfortunately, they find that in this kind of situation, the more stress there is, the more scary the hallucinations become. And although the person knows they're not real, they still fear them because they're just horrible to experience. Another study showed that, and this was in a London hospital, a children's hospital in London, they found that COVID led to hallucinations in half of the children admitted to that children's hospital with COVID. So children admitted with COVID to that hospital, half of them developed Charles Bonnet-like hallucinations. And these were hallucinations they had never had before. The one thing I want to stress is that although people are concerned, even the children, they know that what they are seeing is not real. Those hallucinations are not real. We also know that it usually occurs while a person is relaxed, while they're alone, and often when they're in bed and when they are very quiet. But before we go any further, because I've spoken about hallucinations, I just want to talk about some terms so that you can understand the difference between what we're talking about, hallucinations that are quite benign, and some of the other types of things that people see that could be an indication of problems. Now, I'm going to start with perception, because perception is simply an awareness of your environment. It is basically what you see, and this is by processing sensory stimuli. For example, this fellow is looking at this mug of coffee, and that message goes into the eyes through the retina, and from the retina, it goes to the different visual centers in the brain where it is interpreted as that cup of coffee. That is perception. Visual perception is what you can see at any one time. Then we have an illusion. An illusion is a misinterpretation of something that is actually very real. So in this pavement drawing, for example, this pavement art, really you can see that shark is not real, although it looks very realistic. So when you see the shark, that is an illusion. And this Julian Beaver, who does a lot of street illusions, does them brilliantly, and a lot of them are quite amusing, and I actually rather enjoy them. But as people walk along and they see, for example, that hole on the left, they could trip and fall into it, but the pavement is completely flat. And hallucination then. So illusion is seeing something that is something else, and hallucination is seeing something that is simply not there. There is nothing in front of you, and you just see a person flying, a person in the air. It can be all kinds of things. And we will look at some of those examples in a moment that have been reported by people with CBS. A delusion, on the other hand, and this is the third type that we're talking about, is a belief that the hallucinations that you are seeing are real. So when this kitty cat looks in that mirror and sees a great big lion looking back at him, he believes that is real. And this is common in people, for example, who think that they're Cleopatra or Napoleon, etc., etc. It is a delusion, believing that something is real where it really isn't. In other words, it's simply a false belief. But hallucinations, I want to stress once again, people are aware that they're seeing something that's really not there. So hallucinations are sensory impressions without external stimuli. They are benign. They mean very little most of the time. An illusion means that you're seeing something and you misinterpret it. In this cartoon, a man is waving at his friend, and his friend misinterprets that as somebody wielding a knife who might want to come up, and he feels that he is in danger. That is an illusion. He's not in danger. And a delusion is a false belief, as we said before, like she believes that she's Cleopatra, or, anything that you can delude yourself about. So just remember then that the hallucinations associated with Charles Bonnet are usually just visual. They don't occur in conjunction with the other senses, for example, hearing, smell, taste, or touch. They're independent. There are different types, and I can't really tell you much about them except to say that they take every kind of form that you can imagine. Patterns, line, brickwork. They could be simple. They could be complicated. They could be little animals. They could be bright. They could be dull. They could be black and white. They could be threatening. They could be absolutely anything. The features are that they're usually a fairly sudden onset. They're very clear and defined. They're transient. They could last seconds, a few minutes maybe, and they seldom go on for very, very long. They're usually quite vivid. And as we said, they could be very simple or they could be complex. The person is very aware, I want to stress this again, that these are not real, and they could be very pleasant, but they could also be quite scary. I will mention Lilliputian hallucinations because I have come across a couple of people who do have this. And this is where a person sees themselves as very big and everybody around them as tiny, much like Gulliver saw people in the book. So characters, objects, everything around you is very, very small if you have Lilliputian hallucinations and you are a giant. So we can't describe the hallucinations. All we know is that they're usually very unexpected. They happen when you're resting. They could last seconds, minutes, seldom hours. They often fit into the scene where the person is. They're outside the body. The person, as I said, is aware that they're not real. They actually have no personal meaning to the person. They just appear. And they are detailed, very often clearer than their own vision. And as we said, they could be very mild and fleeting. But now with COVID, we're finding that
the reports are that they are stronger and more persistent.
Here are a couple of examples that have been described by people, like these little guys walking around as little miniatures in a field of mushrooms or toadstools. This was reported by a gentleman who always saw a cat in his brickwork. People sometimes report animals where there are no animals, for example, on a road. And sometimes the hallucinations can really be quite bizarre, almost surrealistic. Like here, where you've got a fish and musical instruments and a man with an umbrella, and you don't know if this is above ground, underwater. It's just an absolute mishmash, a staircase going nowhere. etc. So they can take absolutely any form, and sometimes they appear as rather scary, rather threatening faces. And those are the ones that people don't like. They could also take up quite a lot of the visual field, as we have here, where most of the visual field is covered by all these dots and swirls, or they could really be very, very small, like just one of those little red blobs or one of those little yellow blobs, etc. They could be small. But very often they're very, very pleasant. But as I said, the more stressed the person, the more threatening the visions become. The causes are multiple. I will go through some of them, and some of them are related to vision, obviously. Macular degeneration is definitely very closely related to people developing Charles Bonnet syndrome, diabetic retinopathy as well, cataracts, glaucoma, but also strokes, methyl alcohol poisoning, aging, some medications, and we now know COVID as well. So multiple causes. But there are certain risk factors as well. Visual impairment is one, isolation, living alone, stress, and aging. So you can see that in the past year, this has really brought this problem to the fore. The pathogenesis, if we look at what went wrong, it has been compared to phantom limb syndrome, where, as you know, people with a phantom limb often still experience pain as if the limb is still there. And they think it could be in Charles Bonnet syndrome simply from abnormal firing of neurons somewhere in the brain. In other words, the brain is overworking, trying to compensate for something. And we'll have a look at that now as well. This leads us then to the Deferentiation Theory, which simply means a fill-in theory. If you have, for example, an ocular lesion where you have a problem with vision for one or other reason, you then get reduced sensory input into the brain. So you're not picking up the entire field that you normally see. So the brain says, aha, there must be something there. And it tries to make sense of the missing fragments, and it starts to fill in those missing fragments with bits and pieces that could be stored or that it produces on the spot. We're not quite sure. But this is being studied at quite a lot of detail at the moment with brain mapping and that, and I'm sure it will have far better answers in the not too distant future. If we look then at the pathway of how this develops, if we have a person who is aging, and we're all aging, and/or we have vascular changes, we do have vulnerability of the visual centers in the brain, because those centers start thinking, there are gaps. What must we do? Also, if you have sensory deprivation that we have when we're in isolation and lockdown, and you have visual impairment on top of that, you get reduced input to the visual brain. This then causes release of that abnormal activity, as we said just now, where the brain tries to make sense of the environment and tries to fill in the missing pieces. And you then start getting complex or simple hallucinations. And as we said, social isolation just makes this 10 times worse. To understand Charles Bonnet, we need a lot more research. All we know at the moment is it's completely benign. It actually means very little, doesn't mean much at all. A diagnosis is usually made by your ophthalmologist or sometimes by a very alert optometrist. And if you have poor vision and you have these recurrent visual hallucinations with no other senses involved, and you've had an hallucination within the last month or so, and you have normal psychological status, in other words, you haven't been diagnosed or hopefully not misdiagnosed with something else, and you don't have delusions, then we need to look at the possibility that this is Charles Bonnet syndrome. We obviously need to exclude things like substance abuse, alcohol, physical problems, and other mental illness. And the one thing that we can guarantee for our patients is that this will pass. It does not last forever. The prognosis is really good. The only problem is when. After a time, it seems that the visual areas in the brain readjust to this input that it's receiving, and the spontaneous firing of those neurons just stops. And you go back to normal functioning. The visual pathway reestablishes itself, and then it's fine. We'll have to see what happens after COVID as well. The only problem with this is when is that going to happen? So far, the only thing we know is that it's not a matter of, is it going to happen? It will, but when is it going to happen? As we said, it could last days, it could last weeks, months, years. And the longest report that we have is someone who showed that a couple of people had this for up to 8 years. That's the longest report. And I'm sure that by then they'd become quite adapted to it and quite accustomed to it. The management of Charles Bonnet syndrome, and Claudette is going to talk a lot more about this than I have. If a person has an early warning and a knowledge about this, if they have the information about Charles Bonnet syndrome, it takes away that entire component of stress, and that then limits the amount of unhappiness, anxiety that they go through, and they then are far less likely to have these hallucinations. If you explain the nature of hallucinations, we also know that forewarning allays these fears. Reassurance, tell people and reassure them. This is physiological. It is just the brain trying to sort out your life for you. It is not a psychological problem, and it will disappear with time. At home, you can change your lighting, you can use distractions, you can blink very slowly, you can stand up, you can move around, you can do anything to distract yourself, and exercise. But as I said, Claudette is going to tell us a lot more about this, because we know that prevention is always far better than trying to take on a cure. So, Claudette, over to you to do the important part.
Well, I think the explanations that you've given people have already sown the seeds for them to actually not get traumatized by Charles Bonnet syndrome. So what can we do? Well, you mentioned exercise, and we'll get to that, but there's also, of course, lifestyle. Diet is important, and sleep. I can't overemphasize how important sleep is for regeneration of the discs within the photoreceptors and for brain cleansing. But that's perhaps a subject for another talk. So what can you do? You're getting Charles Bonnet syndrome, you're getting these hallucinations, and you don't know what to do. And the more you think about it, the more stressed you get. So we're going to look at, in the beginning, you can look at eye exercises, neck exercises. As Karen said, you can blink a few times. You can try to touch the hallucination, because that means your part of your brain that's rational, when you touch it and it's not there, will say, oh, sorry, we put that there by mistake. You can stare straight at it. You can walk around the room, or as Karen said, you can change. You can go to another room. You can change the light level or the activity. And a lot of these come from Professor Musaji at Moorfields on her research. So what else can we do? We can do blinking, as Karen said, and you can change your focus. You can do palming. And remember, all these exercises are also good for computer eye strain. So remember, changing your focus is when you look far away, and then you bring your finger closer and closer to your nose, and you concentrate on it until you're actually squinting. So that you've looked far and you've looked close, that's changing your focus. Palming means you rub your hands together until your palms get warm, and on a cold day that warms your hands as well. And then you cup your hands and you look into the darkness and rest your eyes. And that is often also very good for Charles Bonnet syndrome. And then you can also do eye exercises. And these, of course, are the standard eye exercises that have been around for years. You look to the left and you look to the right and you look up and you look down and you look at the top right and the bottom left and vice versa. And you can roll your eyes. You might scare your family and the cat, but they are very good for you. And then, of course, you can do neck exercises. And what you do for neck exercises, you just sit up straight, you roll your shoulders back, you tuck your chin gently in towards your body, you breathe in. And as you breathe out, you turn to the left, you breathe in to center, and you breathe out to the right, and you come back to center. You can do that twice. Then you drop your chin towards your chest as you breathe out, breathe in, and as you breathe out, go gently back, not too far, and you breathe into center. You can also do that twice. And then you breathe in, and as you breathe out, you tilt your left ear to your left shoulder. You breathe in, breathe out, tilt your right ear to your right shoulder, and you come up, and you shrug your shoulders a couple of times either way. And this is also very good for computer neck strain. So remember, those exercises are very good. But what can we do in the long term? Well, first of all, you can commit to regular practice. You have to minimize the effect by exercising the eyes, the body, and the mind. You need to look at stress control, either through breathing or meditation. And then you can, next slide, please. We can look at your body, first of all. And I want you to know that whatever your age, your level of fitness, and your level of vision, there's absolutely no excuse for not exercising. And we know that if the more fit you are, actually the less your chance of getting COVID anyway. So these are multifunctional health ideas. So do what you enjoy, but remember to set yourself modest goals, baby steps. You can do walking or swimming, which probably at the moment with the gyms closed is not a good idea. You can do my favorite, which is yoga. You can do a HIT, which is high intensity interval training. Now, people say, I can't do this, I'm not fit. That's all right. You can sit on a chair, and you sit on the chair and you stand up, and you sit down and you stand up. Use the arms if you need to, and start with modest. 5 is a fine, and working up to more and more. And then stand up, hold on the back of the chair if you need to. You raise your heels and lower, raise your heels and lower. Again, start low, and then work up your reps. And walking or marching on the spot. Holding on the back of the chair if you need to. And you can progress that, of course, to running on the spot when you get strong. You can do leg and arm swinging, obviously away from the chair. You can do side steps. You can do this for 30 seconds, and then you rest for 15 seconds. And you do this for 5 minutes, increasing the reps and the speed. And of course, when you get good, you can do it more than once a day. You can do that a couple of times a day. And then we can do looking at exercising the mind and breathing. Mindfulness breathing is the first step to getting control of your prefrontal cortex, the executive part of the brain. So you can use breath, visualization, affirmations, and gratitude. So I want to tell you that stress and anxiety are manifestations of fear. And this comes from the amygdala, the primitive part of the brain where we experience the fight or flight syndrome. And that's the old part of the brain. But remember that fear cannot coexist with gratitude and compassion. And for the purists, I've added a little diagram on the left-hand side of the screen to show you where the amygdala is and where the prefrontal cortex is. So the amygdala is where fear starts. And if you start to look at that, and as the fear arises, you can change your mental state, because fear cannot coexist with gratitude and compassion. Interestingly enough, the brain can actually only hold one major thought at a time. Breathing activates the parasympathetic nervous system, which is the automatic system that you don't even know about, that gets your blood moving and it organizes all the body functions. And that's a very important as a nervous system. And visualization uses the prefrontal cortex, and that's the executive part of the brain. So how do we disengage the amygdala and engage the prefrontal cortex? And that's what I'm going to show you. So if you would like to sit very comfortably, and I promise you, you're not going to be able to see the screen, whether you're sighted or not sighted, because your eyes are going to be closed. And I want you to remember that I want you to breathe only through your nostrils. Pardon me. You're going to be very comfortable. Your spine is straight and your shoulders relaxed slightly back, and your chin can be tucked gently in towards your chest. All I want you to do is listen and try. We're going to look at breath, and then we're also going to look at affirmations. Affirmations are short, aspirational messages that you give your brain. They're positive and they're now. Because let me tell you, your subconscious mind does not distinguish between positive and negative. It actually doesn't even distinguish between the truth and a lie. It also has no time. So if you say, I am going to try and give up smoking, your brain, subconscious brain, will pick up on smoking, and it'll be part of your brain. So I'm going to show you later on what kind of affirmations you should use. So now let's relax with our eyes closed. In this moment, I want you to tell yourself that all your needs are met. Even in COVID, in times of our terrible social unrest, at this moment, you are safe and you are secure. I want you to become aware of your breath. I don't want you to change it. I just want you to be aware of where your breath is happening. Are you even aware of it? So what I want you to do is take your left hand and put it on your tummy, and take your right hand and put it on your heart. Okay, now all I want you to do is breathe in through the nostrils and take the breath all the way down to the tummy. And as you breathe out through the right hand, through the heart. Okay, again, just breathe in to the tummy and breathe out from the heart. Just breathe through the nostrils. Don't force it. Easy, rhythmic breathing. Into the tummy, out through the heart. Breathing in and breathing out. Breathing in and breathing out. Keep going. Could you perhaps try and deepen the breath a little bit? Or even lengthen the breath a little bit. Your eyes are still closed. Breathing into the tummy, out to the heart. Breathe and out. As you breathe into the tummy, can you feel the tummy getting a little bit stronger and more full underneath your hand? Keep breathing. And as you breathe out, feel your lungs being involved in the breath. How your rib cage expands to accommodate the in-breath and retracts slightly to accommodate the out-breath. Into the tummy and out to the heart. Now we can't practice that for a half an hour, which we should. But I want you just to keep breathing. You can relax your hands. You can still keep your eyes closed. That is the very basis for mindfulness breath. It's not going to become part of your daily rhythm after one session. But if you try and practice that for a few minutes every day, just let the breath be into the tummy and out through the heart. Now, you keep breathing, your eyes are still closed, and your breath is actually breathing itself. So now we're going to look at affirmations. As we said, these are short, aspirational, self-talk, things that you want to have happen in your life. If you feel in a negative state, or you feel Charles Bonnet Syndrome, you suddenly have got these hallucinations, you sit down, you're going to do some breathing, and on the out breath, you're going to do an affirmation. I'll give you a few, or you can make up your own. So you're breathing in, and on the out breath, you repeat quietly to yourself, I feel calm and relaxed. Again, breathe in. You breathe out, I feel calm and relaxed. Again, I feel calm and relaxed. I'm going to give you some others, but I want to tell you that if you find an affirmation that resonates with you, you have to practice it and you have to do it repetitively. You have to do it a couple of dozen or 100 times a day to make a change, because what you're doing is you're feeding into the subconscious mind a feeling of being calm and relaxed. And that subconscious mind will feed that message into the prefrontal cortex, and it happens, I promise you, as if by magic. You will feel calm and relaxed. Some other affirmations you might like to try, especially in this time of COVID. You breathe in. And as you breathe out, you say to yourself, my body is strong and healthy. Again, breathe into the tummy. My body is strong and healthy. Breathe in. My body is strong and healthy. If that one is what you want to choose, you're going to do that as often as you can, and whenever you feel a state of anxiety coming on. Another affirmation that is very good is, especially for Charles Bonnet, you breathe in, and as you breathe out, you say to yourself, my mind is clear and focused. You breathe in to the tummy. My mind is clear and focused. That's a good one for Charles Bonnet, because remember, as Karen told you, the hallucinations are happening in your mind, not in your vision. A good one for COVID. Breathe into your tummy, and as you breathe out, today I am happy. Today I am happy. Today I am happy. Find one that speaks to you and make it your own. It needs to be short, positive, and now. Not I will. I will means nothing. It's I am, I feel, I do. Find one that meets your needs and try one affirmation a week. Don't keep swapping them. They need constant practice and repetition. And I promise you, your subconscious mind will make it real. So your eyes are still closed and you are still breathing. And now we're going to work directly with the prefrontal cortex. This is the creative part of your mind. So these visual hallucinations are being created by your mind. Let's switch. Let's give the creative part of the mind something else to focus on. And I want you, with your eyes closed and your breath breathing itself, to focus on a time and a place where you felt perfect peace, bliss, joy, and happiness. Use your creative mind. See the sights, smell the smells. What sounds did you hear? Who was there? Put all the people that you love into the visual picture, even people who have passed. Reconnect with them by being in this time of perfect peace and happiness. Put everybody you love in the picture, yourself included, and it's your journey. Make it as creative and as fun and as colorful and whatever time and place, embellish it. It's your journey. Who was there? How did you feel? Feel that warmth in your heart. And the more you practice these visualizations, the more effective they will be. So we're not quite finished yet, but it's an exercise that you can park for later. We said that fear cannot coexist with gratitude and compassion and joy, which we've just done. So now we're going to look at gratitude. When you go to sleep tonight, you're going to lie down, you're going to do this breathing into the tummy, out through the chest, and on the out breath, I want you to give thanks for blessings, lessons, or something that happened today that makes you feel good. And on the out breath, you're going to say, thank the universe, thank you for. You can use the person's name, or for the gift, for the blessing, for that phone call that you got from someone who you haven't spoken to, for some act of kindness. If you're really good and you've done a lot of breathing, you probably won't get much beyond 20 and you'll be fast asleep, and that's all right. You go to sleep in a state of gratitude, you'll have a better night's sleep, but you can go up to 100 if you like. Gratitude, and remember to practice compassion. We need compassion even more at this time in our country than ever before. Think of people with love and forgiveness, and let us all be a beacon of shining light in this country at this time. And I would like to finish with my blessing to you, which is Om Shanti, which is a Sanskrit blessing, which means universal peace, peace to you in this time. And I want to finish with the next slide, please, Karen, which is a slide for anybody who's having Charles Bonnet Syndrome, or you want to give it to your patients. It's Esme's Umbrella, which is a UK group, but it's international, for everyone working for the greater awareness of Charles Bonnet Syndrome. And the website is quite a long one. It's Charles Bonnet, double N single T, syndrome.uk/managing your Charles Bonnet syndrome CBS. But if you want it and you can't find it now, we will email it to you, and Gail will certainly give it to you on her email address. Thank you for being with me, and we can now go over to some questions. Thank you, Karen, and thank you, Alta.
Thank you, as always, Claudette. And my problem is always that I can't go very far in the breathing exercises because I doze off. And I thought, oh my goodness, I better just wake up because just now I need to change a slide.
So we have a comment, not a question. And Lynn says, wow, such interesting and informative. I'm learning a lot. Thank you very much, Lynn. And I don't see any hands up. Let me go and look at the attendees. Do we have any hands up?
My question to you was going to be that my daughter-in-law reported that my grandchild didn't want to sleep in her own room. She's being homeschooled, and it's been like right from the very start of the COVID. So right at the very start of lockdown. So, and she said to me, Mom, I really think that it's much more than just being afraid of the dark like it was when we were children. So my question for you was going to be, how do we do it for an 8-year-old? And thank you so much, because you've now given me all the info that I can actually give my daughter-in-law and my son to help this child, because she refuses to sleep in her own room. She's 8 years old. So thank you so much, both Karen and Claudette. As usual, it has been wonderful. We cannot thank you enough.
So, Karen, if you'd like to speak to Alta about how they can find out in a very empathetic, questioning way, without judgment, what is worrying the child. Is it hallucinations, or is it just stress?
Yes, I think it's possibly a combination of all of that, and missing school and being a little bit worried about catching up and friends and, the whole thing. I think there are so many multiple factors these days that contribute to the stress that our children feel. And I think the parents, or Alta, if you know the child well, maybe you can just sit with her and just chat to her and ask her to describe what's in her room. Ask her to describe why she doesn't like the room. Ask her for a full description, because that then gives you a starting point of how you can address it. And then you've got these wonderful exercises that you could teach her that Claudette's just shared with us. And it works as well on little kids as it does on the elderly and everybody in between. So I think the first thing to find out is what is causing her anxiety. And you might find that because she's already 8 years old, if she is seeing something, she's just simply too embarrassed to say it and is too afraid to go into the room and face it.
Okay.
Thank you very much, Karen. And we have a question from a lady with a very nice name, and she's also Claudette. So Claudette, if you'd like to ask your question.
Well, I just need to tell you that I've started this with my macular degeneration, which I've had since my 40s. I'm now 85 years old. And I started with the hallucinations in February last year. And I did go to my ophthalmologist, and with all my macular degeneration problems, he couldn't find a connection. And then we heard recently about this Charles Bonnet Syndrome. My son from America told me he had the link about it. Anyway, I happened to be with the neurologist who I had been to with regard to this problem. I had had an ECG, an MRI, brain scans and everything, and of course nothing showed up. So I went to him a few months ago with this link, and because I can't read anymore. And he opened it up and he read it to me about the Charles Bonnet, and he said, look, there isn't really a cure. He said, but let's try and use this particular medication, which is for epilepsy, and it's called Redilev. I went onto it. It was a gradual introduction. I went onto it, and I must tell you, I am fine. I am absolutely fine. I have no more hallucinations. It's actually a miracle, and because I was getting worse and worse and worse, and I was having some horrible hallucinations. but I don't have any at the moment. And I just wanted to share that with you.
Wonderful. And I'm so glad that you found somebody to address this with you. And yes, a lot of the doctors around the world do use anti-epilepsy type medications, and it does seem to work with some people, not everybody, but with most of them, because what that does is it calms down the hyperfiring that's happening, as we know, along the visual pathway. And because the anti-epilepsy drugs calm down the nervous system, that is exactly a wonderful approach. So well done to your doctor.
Thank you very much, Claudette. I think we have got from G, what an informative session. Thank you very much. We've also got somebody on Q&A. In fact, we have two on Q&A. We've got Lundu Koshle. Does the visual impairment improve with corrections like spectacles or contact lenses if a patient has Charles Bonnet syndrome? Karen, would you like to answer that?
It depends what the original pathology is, because the Charles Bonnet syndrome seems to be independent, especially at the moment, of the degree of impairment in the eye. And hopefully, if one is wearing spectacles and things like that, it might help. But because it's completely independent of that, it might just, especially now during isolation and the stress that we're living under at the moment, it might or it might not help. I think that being recognized and being aware of this problem that is out there will go even more successfully towards maybe preventing too many, and then using Claudette's techniques as well can certainly turn it around. Because as I said earlier, a lot of people are getting these manifestations during the lockdown period and during the pandemic, and these are people who don't have a history of visual impairment. So it seems to be affecting beyond just the visual impairment. So yes, it might help, but it's not a guaranteed help. But a very good question, very interesting, because that's good thinking. Thank you.
Thank you, Karen. I think it's important to know that, as we said, the hallucinations are in the brain. They're not coming from the retina. They're coming from the lack of coherent messages from the retina. And it means that if you stop the hallucinations, the vision that you've got might not be interfered with by the hallucinations. So you might think your vision is improving and you will see better, but the vision, the retinal degeneration or the pathology will not change. It's just your mind that changes. Thank you. So we've got another question from Elle-Marie, and she says, my mom, who is now 78, has battled with this since 2016. She sees very warped faces that look like Mozart, and the colors are always green and red. Does the colors have something to do with Charles Bonnet syndrome?
I think that if she is seeing the faces, it does sound as though it's Charles Bonnet syndrome, obviously, but the syndrome seems to present anything, and it seems to be totally unpredictable person to person. And I know that I did read of somebody whose vision saw most things in blue. Your mom is seeing things in green and red. So it's unpredictable what is occurring. I'm sure it's something that they're going to be looking at now, because as I did say in the talk, there's very little known about this. But luckily, with things like brain mapping that they're doing very intensively in the States and Canada on people with Charles Bonnet syndrome, we might be able to isolate and find a lot more information of why some people see one thing, why some people see another thing. Some people experience it as pleasant, others find it terrifying. Some people see brickwork patterns, lines, who knows? It's just so individual that we know nothing about it at the moment. So I'm sorry, I can't give you a better answer to that. But yeah, we don't know what's going on.
I think I just want to see what's here on the, here we are. My mom, who is 78. Okay, we've answered that one. And then we've also got many thanks for a very interesting talk and providing a practical approach to managing stress. Good to be able to provide an actual solution. And the lady said, I'm sorry, I repeated the question twice. And I think here we are. We've said about Mozart, and she said, does that have something to do with CBS? And we've answered that one. So I think if there are any more questions, you can go onto Q&A or you can raise your hand. Anybody else want to say anything? I would like to tell, and I've told Karen this before, that I got Charles Bonnet Syndrome a couple of years ago when I was experiencing quite a rapid time of vision loss. And remember, with a lot of the retinal conditions, you have times where you have rapid vision loss and then times where you plateau. And when you have sudden vision loss or you have cataract or something like that, it might make it worse. And your brain just can't handle this information. But what I did is I didn't see little people. I saw geometric shapes that kind of swirled, like an Andy Warhol painting that kind of swirled around. But because I was already doing yoga and doing meditation, I managed to actually keep it under control. And after a few weeks, it disappeared. But I also found it happened when I had been using my computer too much. And remember those exercises I taught you about looking far and looking close and blinking and palming? That will also help with eye strain. Are we I'm looking to see if we've got any more in Q&A. We don't seem to have, oh, we have got a hand up. Somebody's got a hand up. And who is it? No, there's nobody with a hand up there. Attendees, we don't have a hand up. We don't have any more Q&A or anything on the chat. So we are out of time as well.
Yes.
And we invite anybody who would like to get hold of Karen or I to drop a line either via our PE office or to head office at retinasa.org.za. And just sorry to correct you, Alta, the website is www.retinasa.org.za.
Yes, sorry.
Yes. And you can also leave your name. There is a reply form on the website, and we will contact you. I would like to thank Karen, as ever, for sharing her wealth of knowledge with us. And Alta, you told everybody to please answer the polls. And
Yeah.
we will, Gail will, the office, Alta and Gail will email you with information about the CPD points. And I would like to thank all the panelists and the people who answered questions. And remember, this has been recorded and it will be available on the Retina SA YouTube, which you can access through our website by going to Learn, looking at webinars. And if it's your first time with us, all our webinars will be up there. And there's some wonderful webinars with various subjects. And we'd like to thank you all and wish you to be safe and good vision. Thank you.
Thank you.
Very much, Karen.
Thank you.
Claudette. Thank you so much. You have no idea how much you've helped us all. We're very appreciative. I'm going to start with my granddaughter immediately. We've got the most beautiful room. It's all fairies and pink, and it's so lovely. Thank you so much.
Thank you, and thank you for all the messages of thanks and appreciation, and that's why we do it. And if you have any ideas of webinars subjects that you'd like us to cover in the future, please don't hesitate to drop us a line. We are here for you. Good night, everybody.
Good night.
Night, stay safe.
Good night.
Night.